Cupping is an ancient technique that uses specialized cups on the skin with pressure to provide pain relief and improve function. And while it's still being debated among the scientific community when to use it, when not to use it, when it actually works, it goes without saying that within our individual circles, we all know somebody who has benefited greatly from it. What I'm going to do with you is I'm going to go over some best practices, when to use it, when not to use it, what we know, what are the different types of cups. We're going to debunk some common misconceptions regarding how much bruising is enough bruising, how much pressure is enough pressure, and we're also going to take a look at why there isn't enough scientific information yet out there. I hope you enjoy. So let's go through the cupping techniques. There are 3 different types of techniques that are the majority of the techniques out there. There's stationary, dynamic, and flash. Stationary is, like it sounds, when you apply pressure to an area of the skin and you just leave it in place. You're going to leave it there for 5 to 15 minutes, and you could use a fair amount of pressure because what you're doing is you're trying to get the most amount of blood pulled into that area. You're trying to get deep fascial work to try to deform stiffness in the muscles or stiffness in the connective tissue around the muscles. This also can help you to be more ready for movement-based exercise like stretching and mobility work, as well as body work after. Dynamic cupping, on the other hand, uses some amount of oils and still pressure, but lighter pressure because you are going to be moving the cup along the area. And what you're trying to do is break up adhesions between the skin and the muscle, and you're also trying to possibly deform surface scar tissue. So light pressure with movement, again, 5 to 15 minutes. With flash cupping, you're going to want to work with someone who really knows what they're doing because you're using some element of a flame and it is done very precisely and quickly to elicit a reaction in the least amount of time possible. Research shows that higher pressure around 300 millimeters of mercury tends to be best when trying to do this type of work, but of course you're going to adjust that pressure to your needs or the needs of the person that you're working with. As for types of cups, silicone cups are best for applying movement to the work, so dynamic cupping, whereas plastic or glass is better for the stationary work. And then obviously if you're working with some type of flash cupping, you're going to need a material that's hard enough for that, like glass. The other thing about a harder cup, plastic or glass, is that you have the ability to be a lot more specific with the amount of pressure than you can when you're using silicone cups. Now for some best practices and contraindications. While we might not know exactly when the best time to use cups is, we do know when you shouldn't use cups, and that is more powerful than anything else and a great starting point. You want to start with lighter suction and work your way up. I had said 300 millimeters of mercury is where they've shown to be most effective for eliciting blood flow, but you don't want to start there. You want to start somewhere south of there. If you don't have the ability to exactly see your pressure, just start lighter and give the body the ability to respond to it. Put some inputs in, get some outputs, make sure it feels like it's helping. If it feels like it's making it worse and it just continues to be worse, chances are you're using too much pressure or it's just not the right idea. Again, you're going to limit the sessions to 5 to 15 minutes. You don't want to spend more time than that. You don't want to spend less. More is not better. If you go beyond the 15-minute mark, you're starting to risk just breaking down tissue and just creating more injury, more trauma to the skin, the muscle, connective tissue. You do not want to do that. It will not be helpful. What you should completely avoid with cupping is if you have a deep vein thrombosis, varicose veins, if there is a fracture that's acute, meaning it just happened recently. If you have an open wound, do not do it. If you suspect infection and you have inflammation and the skin's raised, do not use it. If you're saying to yourself, is this a good idea? I don't know if it is, don't use it. Make sure you first work in conjunction with someone who is a healthcare practitioner that you trust and you know understands you and your needs, and let them tell you, you know what? Good idea, you can use cupping, or bad idea. If you don't follow those guidelines, you risk being seriously injured, you could even kill yourself. So make sure you go through that checklist before you start. So the yellow flags, or the times where you should just proceed with caution, would be if you're pregnant. We just don't have enough research out there for it. Also, if you're on blood thinners. If you're on blood thinners, doesn't mean you can't use it, but those of you who are on blood thinners already know how easily you bruise. You're going to really need to adjust the pressure you're using. If you're on blood thinners, you don't need as much pressure, and it might be best to check in with your doctor first to make sure that it is a good idea. After cupping, you want to make sure you stay hydrated. You want to avoid extreme heat. It's not a good time for a sauna or exposing yourself to any kind of more significant temperature, because you just created an inflammatory reaction, and with that inflammatory reaction, you do not want to create an overreaction. So after you've done cupping, it is not the time to go into a sauna, for example. It would also be best to not do strenuous activity or right after cupping. So you could do more body work, more movement-based practices, work on your mobility, flexibility, but right after you finish cupping, it wouldn't be the best time to then do your higher level, more higher intensity work. And again, the summation of like red flags and yellow flags. Red flags are infection, deep vein thrombosis, open wounds, you not knowing whether you should or shouldn't do it. Those are red flags. Talk to someone else first. If you are on blood thinners or you're pregnant, consult with someone before you start. Just make sure you're going about it the right way and adjusting the pressure according to your specific needs. And most importantly, and most generally, you need to start with a little bit of pressure and work your way up. You don't want to overshoot. Put some inputs in and get those outputs from your body. You want to give yourself a day or 2 days to see how you responded, and then make adjustments and iterations based off of how you responded. You can kind of like fine tune and hone it in as you go. So let's look at some misconceptions and debunk some myths about cupping. First one is, the deeper the bruising or the darker the bruising, the better the healing. That's just simply not true. While bruising is an indication that you've created an inflammatory reaction, which is what you're trying to do, you're trying to increase blood flow, we all bruise differently. So you can't just use bruising as a sign that, oh, well, you bruised there, therefore you must need it more. If you apply cups in a more vascular area with more blood supply, you're going to get more bruising. If you're on blood thinners, if you're older or younger, depending sometimes on just your own genetics, you're going to bruise easier or bruise less. So if you only go based off of the bruise, you are going to be overshooting. Stick within that parameter of no more than 5 to 15 minutes and no more than 300 millimeters of mercury if you can control that pressure. Again, start low, work your way up, see how you're doing, make adjustments as you go. Another myth is that cupping removes toxins from your body. That's not true. The bruising you're seeing is blood flow. It's muscle relaxation, but it is not toxins. As of this moment, there is research for this that has looked to see if there are toxins in the blood of the bruised area with cupping, and there just isn't. It is just more blood. And finally, there is this idea that cupping is just for athletes. That's not true at all. It's for everyone. If you are trying to move better and live better, cupping might be a great option for you. It's simple, it can be very safe, and it is very affordable. So finally, let's look at why there isn't enough scientific research out there for cupping. It really stems from the complexity of this type of research and the lack of funding that generally goes into all of complementary and alternative medicine, or CAM style research, which is the non-medical doctor, more physical therapists, or the non-MD. There's only 0.08% of all funding that goes to CAM-style research. Also, it's just very difficult to control for all variables with a cup. There is a lot more complexity and nuance to how to perform cupping than how to take a pill. Also, There's a lot less agreement and consensus within the CAM community on why cupping's working, when to use cupping, which makes it difficult to narrow down how to perform the research itself. There is research on the amount of pressure you should use and some limited research on why they believe that cupping provides a positive effect. So the overall summary of what I'm saying here is, while there isn't a lot of scientific evidence out there, there is some scientific evidence that shows when you should use cupping and when you shouldn't, and who should and who shouldn't. And it's important that you look for this research and updates in the research to make sure that you optimize best for what can work for you. I hope you found this guide to be helpful. We're going to also create a PDF that will be inside of our social pages community tabs, so that way you have access to this and can look at it. If you have any specific questions, always feel free to reach out. Remember to like, subscribe, share, help us help more people. I'm Doc John from Mobility Doc. Thank you for watching.